Hilda?
Yeah.
Good to see you back. Let me just refresh my memory here. We did lumbar decompression surgery on you on August 19th, 2019. Okay, let me just look at your opera report. L2 through L4 lumbar decompression. Okay, so how did you do with that?
Well, fine, until just recently.
Okay, what happened?
About 8 weeks ago, I started to experience what I thought was sciatica pain. And then it just kind of came and was brief, and then approximately 8 weeks ago, it became a daily pain every day, and tingling going down my right leg, and my foot is constantly numb. Sometimes it feels like a hot streaming down my leg, and then sometimes it feels cold streaming.
Okay.
So, and then daily pain varying from mild to like moderate, sometimes severe.
Always on the right?
Always on the right.
Okay. Is it more in the back or more in the leg?
Well, it starts in the center of this buttock right here.
Okay.
And so when it's really bad, it's really, that's where I feel it the most. And then it just goes down.
It goes down.
All the way down to my foot.
Problems with strength?
Strength is fine.
Numbness?
Oh, numbness, yes.
You do have numbness.
From the ankle down.
Okay, all right. I didn't look at your report because I like to read the films myself, but what I see is you have a synovial cyst on the right side, which is pinching that nerve going down your leg. First things first, you look at your old surgery area, and that's right there, and going up, that looks open. You've got some degenerative disc disease there, but overall, the area where the surgery was done looks clear.
Yes, and that's what the report said as well.
Oh, good, good. I can keep my license then, right? Okay, but on the bottom, down low, you see this little white area here?
Yes.
That looks like a synovial cyst to me.
What is a synovial cyst?
Great question. A synovial cyst is a piece of tissue that forms sometimes where the joints are, okay? It's a benign, non-cancerous cyst, all right? And it comes sometimes from movement. So you see these joints here, they slide back and forth, okay? And they're lined with a tissue called synovium. And they glide back and forth and back and forth. And sometimes the tissues, they're lubricated. There's actually a fluid inside them called synovial fluid, and it allows them to glide. But as we get older, they get a little rougher. And sometimes some of the folds over, and it forms this cystic pocket. And that causes pressure because it's right near the nerve.
Okay.
So your area of your surgery looks perfectly fine, but unfortunately you have a cyst that is formed right on this facet joint, and it's pinching the nerve going down your leg. So, what to do about it? There's a couple different options. The best option, unfortunately, is surgery to take it out. If it's mild or moderate, we can leave it alone. We can try a dose of steroids to settle it down, and I suspect you'll get some relief from that. And if you haven't had a dose of steroids, let's do that by all means.
Yeah, I've never had one.
Okay, so we can start with a simple oral steroid medication and see if it settles down.
Okay.
If it stays away, we leave it alone. Unfortunately, exercise or physical therapy doesn't help it, okay, because it's formed by the motion of the joint. So that doesn't work. Steroid shots can sometimes, again, decrease the pain for a little while, but it's not going to fix the problem of the cyst. Some people advocate putting a needle in the cyst and aspirating it. I don't recommend that, okay? Because what that usually does is it makes the cyst angry, and then the cyst comes back bigger. And also the fluid in that cyst is a little corrosive, a little sticky. And if we have somebody putting a needle in it, some of that leaks out, and then it forms a tighter scar, and it makes it harder to remove later. So
This is an actual small mass?
it's a small little mass about the size of a pea.
Okay.
And it's got some fluid in it. And so people have advocated, some pain management doctors will advocate putting a needle in it to withdraw the fluid. But my recommendation to you is that'll help for a little while. You'll feel better, but then it will come back and it will be harder to treat later.
Okay.
So if we can't get you better with the medicine to kind of settle it down, you may need surgery for this. Now, the good news is, on a scale of 1 to 10, 10 is the most dangerous surgery I do. This is around at 2. Okay? Very common, similar to the decompression that you had, but not as big of an incision. Yeah. Smaller incision. Under the microscope, we go down and we just take that one little area out. It's below your surgery. It's not where your surgery is. It's almost like a fresh area. So, take-homes, synovial cyst, benign, non-cancerous, fluid-filled pocket, pinching the nerve, pinches the nerve, which causes radiation down your leg, the sciatica that you're talking about. Treatments. If it's mild or moderate, we can leave it alone. We can try some oral steroids to try and settle it down. Physical therapy doesn't really work that well.
I have been getting physical therapy and it hasn't worked.
Unfortunately, it's movement doesn't seem to help it.
Okay.
Steroid shot may help it, but only temporary. Aspiration, I do not recommend.
Okay.
And if it doesn't go away, the good news is we can take it out and be done with it. And it almost always, return? It's a great question. All your questions are excellent today. It's possible that it can return, but the chances are low. Okay. So let's try the oral steroid. You've not had any oral steroid, Medrol dose pack or anything like that. No. Let's try that. Let's see you back in a month. I think you'll get better for sure. It's just a question of how long it will help you.
Okay. Can it become worse with time?
It can get worse, and if you have increasing pain, or you start noticing some weakness in your calf, or your fatigue in your calf, then I want to know about that.
All right.
All right. I'm sorry. It's an absolute quick fix, and we'll be done with.
No, but it's a start. I want a good fix, not necessarily a quick fix.
I agree.
Be good.
Okay. All right.
All right. Thank you so much, Dr. McLaughlin.
Thank you. I appreciate it.